I've just presented the PREFER study findings here in Barcelona at the ESC. The PREFER study set out to ask the question of whether we can actually physically see coronary artery plaque activity without actually instrumenting the body with catheters or doing an invasive coronary angiogram or anything like that. We used a technique called 18F sodium fluoride PET computed tomography coronary angiography, which essentially is an external technique that enables us to actually look at how much activity is going on in the coronary plaques itself. Why is that important? Well, at the moment, we use invasive techniques, coronary angiograms, OCT catheters, IVUS catheters, and these are quite invasive, they're not practical, and we can't do it at scale. So we wanted to do a non-invasive test, which is what this test is doing. We recruited over 700 patients in 3 continents, in 4 countries, 9 centers. These patients had just had an MI, so they were already at high risk. They also had multi-vessel disease, so they had large plaque burden. We followed them up for 2 years to see whether we could see whether this plaque activity predicted events. And what we found was that coronary sodium fluoride activity predicted the risk of dying from any cause. It also predicted the risk of dying from cardiac causes or non-fatal myocardial infarction. Interestingly, it didn't predict the need for having stents or coronary revascularization. And so overall, we think this is a really neat technique because what it's telling you is about the activity in the plaque, in the patient, and we can then predict whether they have events. We can intervene, escalate therapy, for example, giving them PCSK9 inhibitors, really intensify their therapy, and hopefully avoid those events. It also provides us with a technique that we could actually test new treatments to see whether new treatments can actually impact on the biology of the heart without having to insert any catheters. So really, we think this is a fantastic technique. This technique is already easy to use. It's used in oncology practice all the time, and so it's readily applicable to the clinic. And so really it gives us, for the very first time, a non-invasive technique of telling patients whether their coronary plaques are hot, active, and likely to cause a heart attack.